Okay, so yeah, I mean the 5G thing, and as you know, I was just interviewed just prior to this. The guy that really is the expert on this is Mark, in that regard. Okay, in terms of the physics of it, and he says it's a weapon system, and that's his area of expertise. I became interested in 5G, like many clinicians and many scientists, because there's been evidence, and many groups have brought evidence and shown that you can damage biological tissue with this technology. I'm just keeping it really conservative.
Yeah.
Okay, fine, great. So where's the safety testing before you roll it out across the globe? I mean, is it an unreasonable thing for some safety testing? And then I looked and realized, from my understanding, there wasn't any safety testing. And I couldn't understand this because I don't know of any technology on the planet that isn't anywhere near as impactful of what this is going to be, because this is going to be rolled out across the globe. That isn't safety tested. So it's just a simple. There shouldn't be any debate about this. There shouldn't be any, argument about this. This is very, very basic. If it's going to be safe, and studies at the moment show it's probably not going to be safe. It's going to be safe. Safety test it and prove it. So and there are many claims about it. I've looked into it, and they've done studies on this. There are people that are sensitive to this type of stuff. Usually they've got other things maybe going on or not. So, but the point is, look, there's no proper testing. So how can we prove one way or the other? And this is it. This is just basic common sense science. So that's my view on it. And really, it's not rocket science to say what I just said. It's pretty common sense.
Absolutely.
But the thing is that when you work with patients, as I do work with patients, one of the things you do is you secure that the bedroom is safe for them to be in. It's not even an EMF thing, it's anything, any allergies, any carpet, because you need to sleep to restore your health. If you can't sleep properly, you're not going to be healthy. In fact, actually, I think some studies show that just on a basic kind of physiological level, that this kind of technology raises cortisol, which is a stress hormone. And if you raise cortisol, especially when you're trying to sleep, that's counterproductive, because it blocks the kind of hormones like melatonin. It blocks these things that you need to rest and sleep. And then, so even without getting way out in the left field of this, just things like if you don't have melatonin, and you don't have the growth hormone released to actually repair you at night, then you're more prone to disease, you're more prone to things like cancer, and this is well established in the literature. So this is just basic physiology, basic stuff.
Melatonin.
You're right. And the thing is, you have to have so just wear some, well, actually no, because it goes with the skull, so you do need complete blackout. So people do wear eye masks. If you can get one that actually covers the front of the skull, that will be helpful.
Really?
But, yeah, because and
I need to get that one.
Yeah, and so this is standard stuff. This isn't particularly clever stuff.
I didn't know through the frontal lobe, Graham.
Oh yeah,
I did not know that.
Yeah, and also as an extension of that, we're talking in terms of this 5G and all this kind of antenna stuff. Mm-hmm. The EMF has been demonstrated that even at a distance, and I was talking to being interviewed earlier, they did experiments with animals. Because when you use a normal phone with Wi-Fi, you're meant to use it slightly off the ear, right, for safety. People don't, they whack it on the ear, and you're seeing all these, what we call ipsilateral tumours. You're seeing tumours on the side where they use the phone, and this is starting to be seen. So you're meant to hold it off the ear. That's when how the safety studies were done. Well, the non-existent safety studies with 5G, what they showed is they can be 40 centimeters away from the head of an animal, and you'll still get effects in the brain of the animal from this microwave technology.